Hi everyone, I'm Rohan and I'm really excited to introduce MedLoop and the team behind it. As a team, we started with a simple question. Why are perfectly usable medicines being wasted while so many people still struggle to access even basic treatment? That question is what led us to build MedLoop.
Hello, everybody. This is Kalyan Madhutegla, the team lead of MedLoop. Now, before I kick in, I'd like to highlight something that I think will make each one of us angry. Annually, about $40 billion worth safe medicine is destroyed, not because it is unsafe, but because the date on the label is passed. On the contrary, 2 billion people do not have access to basic medicines. It's pretty much the same planet, the same medicine, but the wrong system. MedLoop fixes exactly that. We are an AI marketplace that catches near expiry medicine, verifies their safety, and delivers it to clinics that actually need it at 60% below the market cost. No new hardware, no new regulations. We plug into what the hospitals already run. The workflow of MedLoop can be categorized safely into the following five stages, them being detect, verify, match, move, and certify. From a hospital's surplus shelf to a rural clinic's dispensary in 72 to 96 hours is what's guaranteed, with a full WHO compliance and blockchain technology to eliminate middlemen every step out of the way.
Why does this matter beyond business? Because MedLoop directly addresses four UN Sustainable Development Goals. SDG 3, getting essential medicines to underdeserved communities. SDG 10, making treatment far more affordable for those who need it most. SDG 12, reducing massive pharmaceutical waste by putting usable medicine back into care. SDG 17, connecting hospitals, NGOs, and governments and logistics on one interoperable platform. We are not chasing SDGs. We are solving a real problem, and the impact naturally aligns.
Today, hospitals either discard near-expiry medicine or rely on informal donation methods. Disposable is easy but wasteful. MedLoop is different because we combine AI detection, structured logistics, and a tamper-proof audit trail all in one system. We don't just move medicine, we make redistribution legally and operationally safe. Our TAM is $1.2 trillion globally. India's near-expiry hospital market gives us 1.5 billion SM. In 5 years, we target $75 million in redistribution across 100 plus hospitals. Revenue comes from transaction fees, SaaS, data, and government contracts.
Technically, MedLoop operates in four layers. First, a detection layer integrates with hospital ERP system via HL7 FHIR to flag near expiry stock 180 days in advance. Second, an AI verification layer checks storage history, stability compliance. Third, an optimization engine matches surplus to the nearest verified clinic based on urgency and demand. Finally, every transfer is recorded on her Hyperledger Fabric, creating a tamper-proof chain of custody and liability protection.
MedLoop's roadmap is of three phases. The first phase involves launching it with 12 hospitals across Hyderabad and Mumbai. Second phase involves scaling it across India in 3 years, while the final phase aims at expanding it into major hotspots in Southeast Asia through government and NGO partnerships. We are trying to create a system that connects surplus medicine to the people who actually need it. It isn't about efficiency, it's about access, reducing waste, and making healthcare more reachable to the unreserved communities. That's the purpose behind MedLoop. Thank you.